Hospital and Dr. Parag Nandhani, who have just joined us. So moving on to our next session, I will not take much time. It's a plenary session and we would be talking on transforming patient experiences, perspective, challenges and solutions, for which I would like to call upon our Chair, Air Marshal Dr. Pawan Kapoor, who's AVSM, VSM and retired former Director General Armed Force Medical Services. Sir, can we please have you on stage? May I have the privilege of calling upon Dr. Nambiar, CEO, IISC Medical School Foundation, Bagchi Hospital. May I also have the privilege of calling Commander Navneet Bali, CEO, Clearmedi Healthcare. Also have the privilege of calling on stage Ms. Josephine Cyrill, Chief Nursing Officer, Sir Ganga Hospital, New Delhi, and Mr. Amit Aggarwal, Director, Sarvodaya Healthcare, Faridabad. And the time for this session is 35 minutes. Thank you.
Thank you. Good afternoon, everyone. Not a single response. Yeah, thank you. So our session has been reduced by 15 minutes. But we'll give you interaction time with the audience because this subject is of importance. I may have to curtail my question answer to my panelists. My apologies in advance. Okay. Well, you have heard about patient experience, and I must compliment Sarvodaya for having a theme where patient experience is going to interact with patient safety. Rather, they are two sides of the same coin. If a positive patient experience definitely means that patient safety measures are in place, and a negative patient experience means there are certain patient safety measures which are not in place. So there is a connect. Does patient experience lead to positive outcomes? Does a positive patient experience lead to positive outcomes? Or does the outcome depends upon the patient experience? So we'll discuss this in an indirect fashion, how they are related. Now you will understand what we are talking about is patient experience. I don't want to confuse with the terminology of patient satisfaction with patient experience. Patient satisfaction may be one of the measures of patient experience, but they are two different things. And let me clarify beforehand so that we don't get confused between these two terminologies. Patient satisfaction is based upon the expectations that the patient has from a hospital or from the healthcare setting. Two patients with the same disease with different expectations will have different level of satisfactions because the expectations are different. But patient experience is a sum total of all the interactions that take place within the hospital when a patient, throughout the patient's journey in different healthcare settings. Of course, it is shaped by the organization culture. So experience is tajruba and satisfaction is आपको कितना उस सर्विस से आप खुश हुए. Okay, but yes, patient satisfaction can be one of the measures of patient experience. Having clarified the differences, I now have a very esteemed panel with me. I will not go beyond the topic that has been allotted, perspectives, challenges and solutions. So I will start first with the perspectives, and I request Mr. Amit, if you can tell what are the perspectives that we can take into consideration from the patients, from the providers, from the payers, from the organizations with regard to transforming patient experience.
Thank you, sir. Thank you for agreeing to chair this important session. And I agree, 30 minutes is definitely not enough when we want to talk about patient experience. And as we were discussing that, on the outside, talking about patient experience looks a very simple thing, but it's like studying moral science. दिखने में it's very simple कि हाँ ऐसा करना चाहिए वैसा करना चाहिए, but when you start digging, I can challenge you will not find the bottom of it. So thank you once again, and a warm welcome to to all the panelists and everybody who has come today and taken out time from their busy schedule for this conference and making it a success. Thank you so much. I'll start with an analogy. How many of you love cricket? I don't have a raise of hands compared to what it is on the ground.
Maybe after the New Zealand series, all the heads are down.
So in that case, let's refer to the time when we had Tendulkar and Ganguly and all those. How many of you love cricket? I would say a lot of us love. How many of you love Test cricket? Less people. How many of you would love a one-day match? And how many of you would love a T20 match? अब ज़्यादा हाथ आ गए हैं। अभी धीरे-धीरे सर 6 over a match भी आ रहा है। My point is, cricket being at the center of it, you would understand and relate how people would behave differently and how their experiences varying. A person would draw much more joy from watching a test match compared to another person who would not enjoy a test match but would like to see a 20 over match. Now from this analogy, let's come to the hospitals, let's come to the healthcare sector. It is a very vast topic, but I would like to give you an overarching theme of 3 P's, basis which we would agree that a lot of patient experience can be drafted into these 3 different baskets. One is place, second would be person, and third would be the pair. So let's talk about place a bit. We should and we would have to understand that the patient experience would differ from what he is expecting when he visits a government facility. And when we talk about private facility, his experience would vary when he would go to a community hospital or when he would go to a 500-bedded super speciality hospital such as like this. I'll give you an example, sir. We have a small 100-bedded hospital in Sector 19 and we like to call it a community neighborhood hospital. Whenever we are doing construction over there, वहाँ के लोग, they get happy. The people who have been coming to that facility for the last 20 years. Why? We ask them, why are you happy? This is creating so much of noise. वो कहते हैं कि यार ये renovate हो रहा है. It is maturing. इसका मतलब हमारे लिए this facility is getting upgraded. Now come to this setup where we are sitting. This is a 500-bed setup, and people are coming from all over the country and outside India. However, एक छोटी drill से they would create a havoc कि नहीं यार, it is disturbing me, stop it. So that is how the patient experience is being differentiated. So we spoke about place, whether it is a government or is a private. Second is person. A lot of emphasis goes on to the patient. Many of you would agree, patient तो बीमार है, he is on the bed and is at the mercy of the clinicians and the nursing staff. वो नहीं देख रहा कि आजू बाजू पेंट कैसा है, F&B कैसा है, हाउसकीपिंग कैसा है, ग्रूमिंग स्टैंडर्ड्स कैसे हैं. It is the attendant who is with the patient. So we need to identify that when we talk about patient satisfaction, when we talk about patient experience, medical care is at the core of it, और वो change नहीं हो रही, whether it is a government hospital or it is a private of any scale. But apart from that, it is the attendant who is judging a system basis his experience. How a nursing staff, when he or she is coming into the room, how is she talking? How the F&B staff is dealing with me? How a consultant is talking to me? And the third major P is payer. Who is paying for the patient? That also determines how much satisfied the patient is. If a patient is paid, as Dr. Clive said, a patient is very happy with the entire process, but when on the last day he sees his bill and he has to pay out of his pocket, it is natural that he will definitely feel a brunt on himself. So the payer, whether he is out of pocket or somebody else is paying for it. Sir, that is all to begin with. Next you start.
Okay, to add what he has just told, you all had a very good session in the morning by Dr. Malati, and she actually clarified what exactly you should capture during patient experience. So what the patient experience is based upon how accessible your facility are to him when he needs it. She also focused upon shared decision making, how often you involve the patient in taking care of him for which he has come to you. She also focused upon communication between the providers. See the interactions that are taking place now. First interaction takes place at the time he has to access. After that, the interaction takes place at various staff level. Then the interaction takes place with the nursing staff, with the clinicians, and the other administrative staff. All the sum total of these interactions are telling you what the patient is experiencing in his journey through this. So I will not repeat what she has said, but all those criteria that she gave on patient-centric care, they are the criteria on which the patient bases his experience. So we know that he has told you what the patient need. He has told you as a person, sometimes the patient may not be in a position to actually experience what he's going through. It's the attendant who experiences. So let's take patient and patient families and patient attendants as one group, and let's see we are going to capture their experiences to improve our services. So let's see what are the challenges, now I'm not looking at asking for patient experience. Madam, we are looking at what challenges we will face that we transform the patient experience from, madam, are you with me or you are on the mic? Okay. So what I want you to tell the audience that you see in this journey of patient, and he has put another perspective. It's not only the patient, it's the patient attendants, and maybe let's extend it further, the patient family. So these are the persons, and we are going to capture their experiences, and we want to transform their current experiences into an experience in which what they said, the patient is delighted. He is not only happy, he is not only satisfied, but he is delighted. To do this, what are the challenges that the healthcare delivery system will face to transform patient experiences?
Thank you, sir. Very apt question. And being a clinical person and being a nursing leader and had been at a bedside for many years, worked in India and abroad. So a great experience is helping me to answer to this question. And I'm working at a Sir Ganga hospital where we have patients, from morning we had been talking about the patient experience, patient-centric care, and the measuring tools, everything we heard. Then we have patients of all levels, like the setup where I work, patients from the lowest economic strata, around 20%, they are economically poor. They are given free treatment to the high level of education, literacy, political, whatever you call it. You have all levels of patients, and we have to still ensure that patient experience is top priority. So if you look at, there are various challenges. Theoretically, all of us are aware of how to transform that patient experience into a very pleasant experience. We want all our patients to say that they are very, very happy, they are delighted, and word of mouth they will go out and tell other people that this is the place to go and get treated, but that doesn't happen. We have heard from the lectures. What I feel the most important challenge even today is clinical challenges. Clinical challenges, when we say clinical, everyone is there in the picture. Clinical, it is not only nurses, doctors, nurses, dietitians, physiotherapists, the healthcare professionals who are directly interacting with the patient mostly. And the most important grey area where we are facing a challenge, all of us are facing, is communication. I think series of lectures, conferences, workshops happening around in our own workplace, nationally and internationally, but still I see day-to-day communication is a huge challenge. And when you come to clinical, I'll just sum up briefly the medication management. Someone was telling in the talk about pain management. Being a clinical person at bedside, I see patients are still unhappy when it comes to their experience. They say, my pain was not managed effectively. That can be not only therapeutic, means pharmacological, they are also looking at a non-pharmacological measures which we fail many times. And also the diagnostic. The patients come and get a lot of tests done. They compare with the number of tests done for a particular disease elsewhere and this particular hospital. They keep comparing. And then they decide. He was telling 10 to 15% only comes back. But many times in the clinical, the diagnostic experience had been not good. And the complexity of care. Today's time in a healthcare setup, especially in multi-speciality, super speciality hospitals, A single patient is seen by many doctors, many individuals. It is so difficult to communicate between them. And if you listen to the patients and the patient attendants, they are a bit unhappy, and not only bit, they really express. There is no communication and understanding happening between the clinicians and even between the nursing personnel who give handover from shift to shift. And you know that ineffective, poor quality handover leads to serious medication and other medical errors. Next category is operational challenges. Operational challenges is huge. We have seen processes, beautiful graphs, beautiful processes. We have seen targets, goals, and you measure. Still, there are operational challenges. Depends on your processes. So, huge challenges when it comes to operational challenges. And today's time, being a nurse myself, the biggest challenge is attrition and staffing attrition. We train people, we recruit them, we train them, we make them skillful. And I done a study also. 14 months, 13 months to 14 months, their CV is ready and they are going abroad. Huge challenge. The trained personnel are going abroad. So there is staffing shortage. And long waiting times if you are working in a very busy hospital. People come up, I have seen patients telling me during rounds that the most difficult part is to get admitted to this room. Going around, round and round in the OPD areas, meeting one doctor, one diagnostic area, it's all very bad experience. They come and tell. And finally, when they are in the room, they are very happy. So if you look at overall operation, I will not go into detail because of time constraint. Operational, still there are flaws. We all need to work together in our own setup and relook into the processes we have. Once a process is done, we need to keep revising, re-evaluating for its effectiveness. Financial challenges. We keep talking about the big things, and then there is resource constraint, people constraint, whether it is human resource, material resource, knowledge, the facilities, training facilities. There are a lot of things lacking in various setups. Resources are not there, but we are going for accreditation, we are going for high-end quality evaluations, and we fail, and patients go out unsatisfied, not happy. There is budget constraint. When it comes to financial, they are exhausted, and many times the medical outcomes and the treatments happening are not explained to them well. So they are frustrated. We cannot expect. When you look at patient experience, patient satisfaction is more of subjective. But when we talk about patient experience, it is more of everything, physical, mental, social, all together. That is more meaningful, more productive. And the last challenge, which I want to say most important, is the strategic planning by the top management. There is a huge disconnect between many institutions, what's happening at the ground level, what we plan, what processes we make with the top management support. So if the top management have strategies very much in place, supporting the quality initiative, supporting the processes, relooking into what is happening in the organization, though it is happening, maybe that has to be made more effective so that patient experience can be much, much better. Thank you.
I think, Madam Josephine, you have brought out almost all the challenges one can face for transforming patient experience. I will add on one more. And you please tell me whether it has been a challenge or not. Is coordination of care a challenge for patient experience? So that is one more challenge which I add on to the whole myriad of challenges that she has given. Yeah, please.
I totally agree with sir. See, I have seen when we go as a team, that is called a multidisciplinary rounds. When we make a multidisciplinary rounds and meet patients, see, we have that process over there. Especially you meet patients who are getting discharged if you do not have time. And then you talk to them, multidisciplinary. The patient will give you true feedback. How was his experience from emergency or OPD till the time he is on the bed, and from there to the various areas of the hospital, whether it is diagnostic or theatre, or even patient who came to labor room, delivered, then back to the ward. They will give you true feedback. They will give you true feedback. You won't believe. They will tell even how the staff walked in and kept her articles over there, her body language. Communication is not only verbal, communication is non-verbal. When they multiple times repeatedly call in the middle of the night, how we reacted. So I think collateral rounds, and also people should participate when the clinicians are on rounds. clinicians today, one of the major complaints from the patients is clinicians don't have time and they are very, very busy. And just recently, the clinician is cannulating and the phone is keep on ringing. The patient reacted. Either you attend the call or you attend to my need. So patients are very, very vocal today. They tell very openly and they say, you leave the room, you go and attend the call, come back and do the work. Very embarrassing for a professional of that level, but it's happening.
Thank you. I'll come to you last, if you don't mind. I'll move on to Commodore Navneet, and there is nothing to do with ranks here. So I can exercise my authority as a senior ranking officer. Okay. No. I never ranked her in college. Okay. Yeah, Commodore Navneet, I'm slightly debating. I want to know from you as a CEO of Clearmedi Healthcare, how do you think how do you see patient experience as a transformative issue for you? And if you are basically, I think you're a Morgan Stanley invested company. So such company, how does it see patient experience as a transformative issue?
Thank you so much, and it's a privilege to be here. Thanks to Bobby. She always manages such a positive attitude, and every time I've seen her. Thank you so much for calling me. So imagine in our hospital, we had only robos walking inside as patients. And imagine in a hospital, there were only robos treating the patients. Then everything that you said since morning was correct. You use the AI, you use the technology, everything is absolutely mathematical. Everything happens exactly as per the norms, as per the set standards of mathematics and physics and laws. But we human beings are not like that at all. So I would just bring a completely different perspective. Now please imagine, have you ever heard about people who travel in bullock carts and tractors and government buses ever complain about experience? You'll only hear people who travel by airlines in Vistara, Singapore Airlines talk and give Google reviews. They don't. Why? Because they're just bothered about doing what they're supposed to be doing, and they're just bothered about that event to get over. I had 8 hospitals across the country. Most of them are in Tier 2, Tier 3 cities, deep inside villages. There's a hospital ahead of Baroda where we treat 300 patients on couch every day. They're cancer patients, tribals who are coming from borders of Gujarat and West and Madhya Pradesh inside the hospitals. Have I ever asked them or have ever complained? Have they ever talked about patient experience? Never, ever, ever. This is a new rich metro, sub-metro cities phenomena that we are now seeing. The patients, you just move out 20, 30, 50 kilometers out of the metro cities. They're just bothered about coming to the hospital, getting treated and going back. Having said that, as it was rightly said in the beginning, a lot of things has to be done by the place and how it measures. When we come down to metro cities, and we had a hospital in Noida, we're just starting a hospital in Mohali, and we have 2 hospitals in Mysore. So it all comes down to perspective and expectations, what are being said in the society today. There are 2 things which are happening. One, the clinical side of the story, where a patient comes, gets treated, and that is the quintessential requirement of healthcare system. A patient is coming into the hospital to get cured and getting treated and going back again. Everything else that's happening, whether the appointment is booked on time, the tests on time, the reports are coming on time, discharge, admission process, food, housekeeping, everything is revolving around that, but it is not the centric to that. When you go on an aircraft, are you ever bothered about how the pilot flew the aircraft? You're least bothered about it. But you are much bothered about how the ticketing took place, whether you were escorted properly, whether your baggage was carried properly, whether the air hostess behaved with you properly. Everything of that comes into place. Have you ever heard a single complaint that the pilot made a left deviation or landed slightly heavily or did not fly rightly or what? You are not bothered about it. Similarly, we need to first understand this difference. We go on talking about it again and again and again and again. The patient experience is a sum total of the expectations that the patient has and their attendance, as rightly said, in a different hospital, in a different setting, as per their own expectations and how it happens. Please remember also, many of these things revolve around our staff. Imagine our staff from day in and day out, seeing people who are in agony, facing attendants who are very, very unhappy over certain things, and they will be unhappy over, because healthcare is such a business where you are looking at sadness, you're looking at disease, you're looking at pain most of the times, except when you're going for birthing and things like that. I would just go on to say one single thing. Patient experience is also a cultural thing. In organizations where the founders, the CEOs, the heads of the hospital put inside a simple phenomena that we need to be empathetic. Is everyone in the system empathetic? And also nurses, I think I would also put one very, very important, I think from the World War II, when hospitals, the soldiers who became wounded and came from the battlefield, there were hardly any doctors. From time immemorial, it's been nurses who are the center of everything that happens around the patient who's on the bedside, and everything else with the attendant is happening somewhere else. So these differences, if you are able to see, and that's what I am doing in my organization. You asked me specifically for Clearmedi Healthcare. We have hospitals in the best of the cities. We have hospitals in towns and villages where only tribals come here to get treated. But one thing that we are inculcating in our staff is empathy. One thing we are inculcating in all of us, the culture of understanding that someone who's coming to your doors is suffering from pain and you need to treat them like this, despite the fact that many times they are going to be a very, very difficult person. You heard about 2 days back, this incident that happened in Chennai, I think, where this patient walked into an oncosurgeon. The son stabbed the doctor 10 times, walked away with a knife and threw it, and it just happened 2 days back. So we continue to see these dichotomies happening all around us in healthcare systems, but yes, when God has given us a chance to be in an organization where these are the qualities we need to imbibe, and in addition to what is happening in AI and in technology and in systems and in computers and in your processes, I think humans still remain at the center of everything which healthcare does. And if those organizations where that is the main thing, I think, whether it is a small town or a large metropolitan cities where the expectations of attendants and patients are at the roof level, I think things will be almost all right. Thank you.
Thank you very much. Dr. Uma, you have heard what are the perspectives, what are the challenges, and you have heard him about so many aspects that he brought out in the metros, in the cities, in rural areas. So now, audience is looking for the solutions which you can implement at their level to transform patient experience. You can say with some examples, it become easy to understand.
What I will do, because you see, every patient expects a different outcome and a different experience, and it is based on their own background, their own biases and preconceived notions, and also the fact that when they get into a hospital, it is a sudden event which was never expected. So the suddenness and unexpectedness of the event adds to their anxiety. So in that anxious, fearful state, there is a lot of non-healthcare related things which they start to experience, and that is where the patient experience and not just patient, as you said rightly, it's patient and the attendants and that whole cohort as a unit. It is that experience. So we will literally need to individualize many of them, and for all of us that is the biggest challenge, because there is no one shoe that fits all. So I'm going to give you a few examples of what we have done and what I think has worked. So let's understand this thing about communication. Now in communication, all of us take audio visual consents, yes or no? Why do we take? Because we think when there is a medical legal case happening, we'll cover ourselves, right? One of the biggest challenges when we communicate with the patient is that it is a one-time event when a doctor communicates with the patient. And on many of these things, these are serious things that we discuss. We don't go back and communicate again. If we made it possible for us to play back that consent to the patient on his phone and just give him the access, will that patient's anxiety becomes less? Will their complaint on a post-op event become less, because they have already been talked to? When, let's say, if I talk to a patient saying that post-operatively you will have left-sided hemiparesis, he doesn't even remember that I've talked to him about. But next day, when the patient wakes up and he can't move his limbs, the relatives say, "Uska to ji haath pair nahi chal raha." right? But if we can play that back, saying, you know what, you have prepared yourself already, it's an informed consent, and so the level of trust with us improves, and also this doesn't count as a negative feedback, that doesn't come as a pain point to them. It's an experience, so it's really about that, about making the patient and the family comfortable. Another thing that I find is that I tell the clinical teams that when you as a senior doctor talk, you need to have somebody who will reinforce and augment that conversation that has happened. I have employed nurses in the team just for this purpose, okay? And they are experienced managers for the patient. So that whenever they need to, they will keep going back and saying, have you understood? Do you want this conversation to happen again? And the doctors can go back and repeat parts of the conversation which are uncomfortable or which are not very well understood or which are misunderstood. Many times misunderstanding is a problem with the patient, which I realized when these girls have come back and told me that they didn't understand. Doctor meant this, but this is what they're thinking. So this is one way where we've thought that, okay, we can address, and we could find small solutions like this for multiple areas of miscommunication that happens, or misunderstanding of communication is what I would say. So this is one, okay? Another area that I find is food. Food is something that everybody has a bad experience with. And you know who has a bad experience with food? Not the patient. Patient has absolutely only one concern: they want to get well. They couldn't care what they're being fed. But the problem is with the attendants, because they sit the whole day without doing anything. They're leaving their work, getting bored, and having bland, useless food to eat. Okay, so there was this, we had a lot of international patients coming from certain religious communities where they would not eat vegetarian food at all. Vegetable doesn't grow in their countries. So, but our hospitals, majority of them serve vegetarian food, right? So sometimes you have to fight with your policymakers. You have to do things which are not in the rules. Try to see how you would find solutions. So you know what I did? I outsourced the non-vegetarian food service to a restaurant nearby and had an arrangement that the hospital will pay the bill, because the patients need it in their bill because they're going to get reimbursed from their payers. But the relatives needed this non-vegetarian food, and the hospital kitchen was not going to cook, and we didn't want to change that. So it was easy. So today you can Swiggy it or something like that. I mean, you can have so many choices. This was before the Zomato and Swiggy days, that I had an arrangement with 2 non-vegetarian restaurants. Just outsourced the non-veg food and they took service. So nobody in the hospital, nobody in the senior owners, nobody had a problem, because everybody then, otherwise they were changing from our hospital to another hospital because food was a problem. Okay. So one, discharge time.
A foot massage in case you are getting late for your discharge. I think we can also, all of us rather, can think of giving some such services which would probably give little more satisfaction or add on to the satisfaction which the healthcare care provider has given. Now I would request Air Marshal Dr. Pawan Kapoor to please felicitate our speakers, and may I request all of you to please come on the red line. May I request Dr. Pawan Kapoor to felicitate Dr. Nambiar.